Yes, thank you. Ricarra Davis has been my student in the graduate program for 2 years. She's worked as a GIS specialist for the Alabama Department of Economics and Community Affairs, and is currently working on defending her capstone and will graduate in May. So we're very proud of the work she's been doing on various topics spanning from economic development to what you're going to hear about today with health and GIS.
Good evening, everyone. I am here to present my capstone, and it is focusing on a proposal for cost-effective mental health facilities in the United States. If you would like to follow along, I have a QR code here. You can scan it, or if you want to review it for later, there's a lot of data that I may not cover, but it is there for if you have any questions. So this research aims to contribute significantly to the support of individuals battling suicidal actions. Central to our objective is to evaluate mental health awareness and innovatively propose the establishment for cost-effective mental health facilities, especially in economically disadvantaged areas. My research focuses on 4 distinct regions with notably high poverty rates within the United States. In the Western region, we focus on California. Southern is Alabama. Southwestern is going to be Texas, and Northern Pennsylvania. Notably, suicide was identified as the 11th leading cause of death in 2021. The suicide rate had surged by 30% from 2000 to 2020, with a staggering 37% rise during the COVID-19 pandemic, which are the years of 2020 to 2022. Utilizing a blend of quantitative data analysis and qualitative case studies, the subject will offer comprehensive insight to the current state of mental health services and identify gaps in existing infrastructure. Alarming statistics have proven that young adults between the ages of 18 and 25 years old attempted suicide in the year 2021. In the chart below, we observe a shocking 2.7% increase in suicidal attempts in that age range. Here is a map that I created with census data. There are 5 maps between the years of 2018, I'm sorry, it might be 6, between 2018 and 2023. And you can see here the increase of suicide rates across the United States. Suicide deaths claim the lives of over 48,000 individuals in the United States. With the focus area research in California, California lost a total of 4,184 individuals, Texas 4,193, Pennsylvania 1,885, and Alabama 827. Suicide claimed the lives of collectively 11,053 individuals within the 4 states that I am researching. That is roughly 23% of suicide deaths in the United States in 2021. Nationally, there is a need for a total of 282 mental health providers per 100,000 individuals, which is 355 people per mental health provider. This is an interactive map. If you click on your any state, it will bring up the statistics for that area. And you will see the need for how many mental health providers are needed for that area. This research analysis emphasizes on the post-pandemic year of 2022. The data most beneficial to this study derives from the 2022 County Health Ranking census data. The concentrated variables are as follows: suicide rate, estimated population, median household income, and additional research includes mental health facilities as well as hospitals. The reason for the differentiation between the mental health facilities and hospitals are some facilities are solely dedicated to mental health versus hospitals may still be overwhelmed from COVID as well. Texas had the highest number of suicide deaths in the year of 2021. They have a total of 38,679 mental health providers per its population of over 29 million people. It still needs 44,000 mental health providers to match the national average. California had the second highest. There are a total of 161,653 mental health providers per its over 39 million population, people in population. Next, we will look at Pennsylvania. Pennsylvania has over 12 million people and only 30,391 mental health providers. Pennsylvania still needs 5,645 mental health providers to meet the national average. Last is Alabama. Alabama has 5,818 mental health providers per its population of over 4 million people. Alabama still needs 8,056 mental health providers to meet the national average. Due to the nature of this research, we have selected variables to contribute to the need for cost-effective mental health services. Methodology includes need assessment maps to run analysis using 3 key variables from the census data, such as population, which is under 65 with no health coverage, people living below the poverty level, and people who do not receive a high school education. Our goal is to highlight areas where individuals may not have access to mental health services due to life circumstances and the ability to qualify for systematic access. Based on this analysis per region, we have selected 3 counties per state where cost-effective mental health facilities would be most beneficial, and there is a need for these facilities in the community. California, the areas that are in the darker purple are the areas that are in most need for mental health services. Also, these areas are of the larger population, but as stated before, there are not enough mental health facilities to service the population in those counties. These counties are as follows: Los Angeles, California, San Diego, California, and Orange County, California. For Texas, Harris County, Dallas County, and Bexar County. For Pennsylvania, Philadelphia County, Allegheny County, and Lancaster County, as you can see there. And then for Alabama, Jefferson County, Mobile County, and Madison County. My proposal is to advocate for mental health services accessible to people who experience an economic disadvantage. While suicide is the 11th leading cause of death in the United States, with preventative methods, awareness, and accessibility to resources, we can strive to reduce the rate of suicide. The data analysis presented in this research demonstrates the rise of suicide deaths in the United States over the last 5 years. During the COVID-19 pandemic, people were not able to access the support and resources due to isolation implementation. With those years, there was an increase in the suicide deaths. Connection is a key component to reducing suicidal actions. After the pandemic, census data analysis reveals an inadequate amount of mental health providers per state per 100,000 people. This research is constructed to highlight communities who are below the poverty level, who do not have access to health insurance, and who do not have a high school education. This demographic may experience a higher rate of life stressors, contributing to the rise of suicide due to lack of accessibility, support, or mental health services. If obtainable, cost-effective resources were accessible, the impact would decrease in suicide deaths, the impact could increase in suicide deaths within these communities due to financial obligation being eliminated. This proposal is for state and or federal funded mental health services in economically disadvantaged communities. To help achieve this overarching goal to lower the national suicide rate in the United States, we are advocating for a need for more mental health facilities per 100,000 people so that all states meet the national average of the 282 mental health providers per 100,000 people. We propose for some of the facilities to be cost effective with state or federal funding to create accessibility to resources for economically disadvantaged communities within each state. The final objective of this research is to help people get connected to volunteers and alternative services within their communities. This proposal is to bridge a gap of inadequate support and resources amongst all communities. Our next step, preventative methods and research, is in hopes to spread more awareness to all communities to have accessible mental health services, provide opportunities for further research using different variables, help connect people to current resources and support groups, and approve proposals and funding cost-effective mental health services. As of right now, the CDC currently is funding 24 national programs under the Comprehensive Suicide Prevention Program in hopes to reduce the rate of suicide by 20% by 2025. How has suicide affected you? My research was influenced by the passing of my brother in June 2021. He died by suicide. He was one of the 827 individuals here in Alabama who passed. My advice to you and for everyone in our community is be the change that you want to see. Thank you.
Are there questions for our speaker? Yes, Chuck.
The number that you had for the number of mental health providers per 100,000, was that an average or was that a recommended number?
That is the average.
Average.
So I believe per 100,000 people.
In your study, do you have a breakdown, like if there were some veterans in there?
That is one thing I wanted to focus on due to my father being a veteran, but I did not touch on it. But there is funded programs for veterans provided by the CDC. That is also something I want to extend my research on.
You may want to contact my wife. She just got funded, and she's going to be doing the veterans several similar to that.
Awesome.
Her name is Dr. Marie Valentin.
Okay, thank you, thank you.
Such a tough topic to be discussed openly, especially in a university setting. So overall, we think that this is actually a great approach for us to kind of have open discussions. Would that be maybe, would it be possible if we discuss it very openly in our communities to affect some, for example, maybe young adults would be more vulnerable?
I believe that discussing this topic is very vital, especially among all age groups, because I know quite a few people. Ricky was not the only person who died by suicide that was close to me. There were quite a few people I know. When I was in high school, I had a friend who took his life as well. And I was a freshman here when I found out. I believe all ages, it is a tough subject to talk about, and a lot of people don't want to talk about it, and that is the reason. That's one of the contributors to why the rate of suicide is high, because it doesn't want to be discussed. Or people are like, oh, hush, that's private. It's not. It's not. And sometimes you can help people. That's why I said be the change you want to see. You can help change someone's life, even just a conversation or just being there to listen.
All right, let's thank our speaker again.